You are in Resources for New Mexicans Coping with Cancer, and we are more than excited to um, share our information with you today. Let's see. Today I have with me Angela Futch, and she is with the ADRC, and she will tell you all about her program when it's time. I also have with me Sonia Pierce. She is our LIPA program director, and she's got a lot of different resources to share with you. So let's go ahead and get things started, and I will start first. So for today, we are going to talk about where you can begin to find assistance. And then also we will talk with Sonia about the LIPA program that Cancer Services has. And then we will talk with Angela about the Aging and Disabilities Resource Center. And today we are hoping to talk with Lisa Parson from Cancer Support Now, but unfortunately she wasn't able to make it. So I'll just kind of give you a little bit of information about what I know about their program. And then also we'll talk about the Cancer Support Treatment Directory. So moving on, the most important thing someone can do when they're coping with cancer is strengthen their support network. And that's just not for the patient, that also includes all the family members who are helping that patient go through their cancer treatment. So number one, what we would recommend to do is to first reach out to your clinic or hospital, wherever you're receiving your treatment, and see if they have a patient navigator. The patient navigator can be a great resource to all things that are within your community. I know that not everybody is here in Albuquerque or Santa Fe. I do know that Las Cruces has a great resource program. Also, Deming and Luna County, Farmington. So everybody's got some type of place or person that you can contact and get those resources. So please do ask your hospital or clinic if there are any patient navigators that you can connect with. Next, I would also suggest to connect to support groups. These are great ways to talk to one another, other cancer patients, and be able to just feel better about yourself, to eliminate those feelings of feeling alone. It can also help to improve your mood and help you develop some important coping strategies. Next is to look for those community resources, and that might be through that patient navigator. Those can also come from your support groups, and they can also come from reaching out to organizations like ours. We can, at Cancer Services, help with finding ways to offset some financial difficulties, maybe some issues that you might be going through while you're employed and still trying to work. And other support groups can help with things like relationships within your family unit or also with friends. So moving on, Cancer Services of New Mexico does provide this wonderful resource bag, is what we call it. It's the Family Cancer Resource Bag. It contains all types of information that helps families, parents, and children to talk about the cancer and the treatment, things that they're going through. A lot of times children don't understand, why is mom losing her hair? Why doesn't she want to play? Well, this bag has great information about how to sit down and talk to your children. As you can see in the little picture there, we've got little activity books and picture books for the younger kids, and there's even things in there for teens, how to talk to them about your cancer in ways that they can also cope with that cancer. There's a little cute lion here that kind of symbolizes courage for the kids. So, and if you would like to get one of those, they are available at any clinic throughout New Mexico, or you can reach out to us. We also have this great New Mexico Cancer Support Treatment Directory, and this is put out by the New Mexico Cancer Council. So you can get this by reaching out to going to the link down below, and we will have these slides for you later on so you can access that resource. And this directory includes all of the nonprofit organizations, clinics, hospitals, anybody that has any kind of help or resources that they can give to your family. I highly recommend that you pick one of these up. You can reach out to us, and we can also help facilitate in you getting that information. So moving on, this is my last slide here. And again, this will be up for you. So next, I am going to introduce Angela, who is, I'm sorry, Sonia, who will talk about our LIPA program. There you go.
Thank you. Hi, everybody. Sorry you guys can't see me, but maybe that's for the best. I do have a cold, so I probably look puffy. But I wanted to talk a little bit about our Legal Insurance and Paperwork Assistance Program. That is what LIPA stands for. And it's a free program to help New Mexico cancer patients and survivors, their loved ones, manage all the difficult legal, insurance, billing, and paperwork issues that arise after a cancer diagnosis. So the different types of things that are included in that are Social Security and disability benefits, wills, power of attorneys, advance directives, understanding insurance paperwork, copay assistance, assessing insurance, or referring you to maybe one of our great Medicare brokers to help with that. And also referring all over to ADRC, which is the Aging and Long-Term Services Department. So since 2006, LIPA has helped over 7,000 New Mexicans coping with cancer access over 10.5 million in medical, legal, and financial benefits. The different types of assistance that we can offer are one-to-one appointments, where I can schedule some time either at UNM Cancer Center or New Mexico Cancer Center. I can also go out to Casa Esperanza and schedule a conference room there and do some of these appointments. We do referrals to different agencies or to different funding sources, like for breast cancer to the Pink Me Fund. And then if you notice there's our LIPA website, which is the www.nmcancerhelp.org. And then the segue into this next one is that we do offer a free 13-pocket cancer treatment organizer that all you have to do is either email or call our main number, or call the number there, which is my cell phone, my work cell phone, or email there. And I can mail one of these out. And I know Janet mentioned the New Mexico Cancer Support and Treatment Directory. One of the directories is also included in all of the cancer treatment organizers. So they are labeled, the 13 pockets, with appointments, medications, what to ask the doctor, and we offer those 4 different colored sheets in the corner on the right as part of those. That way you can write all these questions down, write down your medications. If you're not the type of person that uses MyChart and you want to have something physical to look at, this is a really good tool. We also have the 5 wishes, which is an advanced directives type of thing that you can fill out, as that way your loved ones know what you want done on your passing. And I think that's it for right now.
Great. Thank you, Sonia. Next, we have Angela Futch from the ADRC.
Okay, good morning again. My name is Angela Futch. I work with Aging and Long-Term Services Department. I'm a SHIP coordinator. I work within the Aging and Disability Resource Center, and our workshop objectives, we're going to go over, we're going to do an overview of the Aging and Long-Term Services Department, the ADRC Resource Center, and introducing important consumer assistant programs from the SHIP program and state senior SMP, which is Senior Medicare Patrol, and we'll go over that. So the New Mexico ADRC's mission statement is services all New Mexico's connecting people with resources to maximize personal choices and independence. We service real people. We have real answers and real options. We help people understand their options, guiding them in the right directions, advocating on their behalf, and improving their quality of life in some way are basic concepts of the New Mexico ADRC. So I just want to say, I consider it kind of a one-stop shop for services available throughout the state. So we do have the options counselors that empower individuals to make informative decisions about long-term care services and supports. We provide a clear pathway for individuals to access long-term services and supports. We help individuals understand and obtain benefits for which they are eligible. So what we do is when an individual calls in, we screen the individual, and every call is different. It could be from a person needing food to a person needing rent. We kind of screen and assess their situation, and it's usually more than what they're calling for. How are they living? Do they have natural support? So on and so forth. So those are kind of some of the calls that we do receive. We provide short-term assistance, and I'll go over that as well, in connecting individuals to available services and supports. And we make referrals to assist in resolving any issues. And we'll go over that too, because our team, the SHIP coordinators, take care of that short-term assistance in resolving any issues. So we are also the intake line for a program which is through Medicaid. It's a home and community-based waiver. The waiver is we maintain the central registry. So as I mentioned, we complete the assessment over the phone and place them on the registry. The home and community-based waiver is basically designed to keep an individual out of a nursing facility and in the home, and provides care within the home. We educate callers on Medicaid benefits and services. So there may be other Medicaid categories an individual may fall underneath that the category. We kind of screen to see if they may be eligible for that program. We provide information on managed care organizations, and what that is they are the MCOs that set up services for individuals when they are on the home and community-based waiver. And we educate callers on self-directed waiver options. So what that means is basically when and if they're eligible for the Medicaid benefit, there are options to receive an MCO and have someone take care of and set up the services, or self-direct is kind of managing your kind of like your own business. You're going to do all the hiring, the firing, all the timesheets, so on and so forth. So we also do have a live chat. The live chat, we would go to our website, which is www.aging.nm.gov. Wait, I'm sorry. Yeah, and what you'll do is you'll click on this live chat, and you're going to speak with a live person and ask general questions. Sometimes, people don't want to wait on the holds for, however long, and you can definitely hop on this if you have access to the internet and speak with someone, ask any questions regarding services that are available from Medicaid to Medicare, so on and so forth. We do have counselors available Monday through Friday, 8 to 5 p.m. Also, you can definitely contact our office at 1-800-432-2080. So I want to tell you a little bit about the State Health Insurance Assistance Program. We provide answers to questions and concerns regarding private and government benefit programs. So again, it's Medicare and Medicaid. The state health insurance programs are, we're out in the community. So for example, we offer one-on-one benefits, counseling, and assistance for open enrollment, October 15th to December 7th. We are out in the community sitting face-to-face and maneuvering through their Medicare benefits. And if you're new to Medicare, if you're having billing issues, we can educate you on your original Medicare along with Medicare Advantage plans, supplement policies, Medicare Part D, or low-income subsidy programs to help with your prescription drug costs. We ensure that New Mexicans receive accurate, unbiased information about healthcare options and other entitlements. SHIP does not sell, endorse, or recommend any specific insurance plan or health plan. So underneath the umbrella as well, we have the Senior Medicare Patrol. They prevent healthcare fraud for Medicare individuals and Medicaid beneficiaries. And we educate individuals also as far as how to avoid, detect, and prevent healthcare fraud. And we help preserve the integrity of Medicare and Medicaid programs. We educate and inform Medicare beneficiaries how to protect their personal identity, identify and report errors on their health or care billings, and identify deceptive healthcare practice, such as illegal marketing, providing unnecessary or inappropriate services or charges that they may receive from their provider. So our biggest, scam right now is it's a back brace that they're stating it's on their bill, and they never received a back brace. So if that comes about, please do give our office a call, sorry, not back. So we also have the prescription drug assistance within our office. And what we do is provide information about pharmaceutical company patient assistance programs. And what we do is we access applications through pharmaceutical companies to help individuals with their brand name medications for free. If you're in need of assistance, you definitely call our resource center and give a list of medications. If a medication is not on our formulary, there could be other resources available, like co-payment relief programs, discounts, $4 co-payment. We do have that list as well. We do assist individuals who are underinsured and uninsured that can't obtain their medications and help afford their costs. So. And underneath the umbrella of our department, Aging and Long-Term Services Department, there's Adult Protective Services. If you feel like someone is being abused, neglected, or exploited, there is the Ombudsman program as well, which advocate individuals in a nursing facility, Area Agency on Aging, which provides funding for seniors, senior center, and the Office of Indian Elder Affairs that provide services for our Pueblos and Indian community. Native community, sorry. There are great information and workshops that are on our website as well. There's YouTube that, little trials that you can definitely watch on Medicare One-on-One, Medicaid, so on and so forth. I think I'm running out of time, right? And we do have a newsletter. If you can go to our website, you can definitely click and participate on our newsletter if you want to receive any information. And then here is our phone number. We service within these areas, or our SHIP coordinators are within our areas. And please let me know if you have any questions.
Great. Thank you so much, Angela. Just on time. So
I was like, am I going over time?
no, you did well. You did well. So there is a question for you. I
Sure.
believe it's for you because I don't know the answer to it. The question is from Victoria, and she asks, what is MSO?
Oh, managed care organizations. So the managed care organizations they're insurance plans that are contracted under Medicaid. When an individual has full Medicaid benefits, they are so for example, right now, they're coming along as the managed care organizations are United Healthcare, Molina, Presbyterian, and Blue Cross Blue Shield. If you have full Medicaid benefits, you choose between these MCOs to take care of you as far as your service. So if someone is needing home services, they're gonna assign a care coordinator within those insurance, whomever you chose. And say you chose Blue Cross Blue Shield, they're gonna go out, complete the assessment to determine the need in the home. And or, you know, if you have dental work or so on and so forth, that's the MCO that's gonna take care of it. I hope I answered your question.
I think you did, but she has a follow-up question.
Sure.
She also asks, is there a contact for ADRC in Gallup, New Mexico?
So the main number to the Aging and Disability Resource Center is the 1-800 number. So again, that's 1-800-432-2080. And we do have a SHIP coordinator that just started in the Farmington area that's going to service that area. So yes, we'll have someone there.
Okay, great. And she also typed in, thank you.
You are welcome.
I'd also like to add a few more resources that I will put on my slides later on. We do also have the Family Caregiver Center of New Mexico. We were hoping that they would be able to come and speak with us today, but they weren't available. And what that is if you are a caregiver and you are looking for a way to reach out to maybe other peers, people that are also taking care of a family member coping with cancer, this is a great place to reach out to. Again, it's called the Family Caregiver Center of New Mexico, and you can reach out to them. Their phone number is 505-494-4021. Next is the Senior Citizens Law Office, and they're quite helpful in dealing with wills or advance directives or anything that you might have, any kind of legal issues. And you can reach out to them at 505-265-2300. And last but not least, we have the Caregiver Support Now organization. And what they do is they help people with emotional support issues. And they have group meetings. They do also offer one-on-one support for all stages of cancer. So they're a great resource in our community, and I recommend that if you do need emotional support, that this is the place that you start. They can be reached at 505-255-0405. And again, all of these organizations are willing to help anyone throughout the state of New Mexico. If you need any additional help, of course, reach out to Cancer Services of New Mexico. That's why we developed this organization, was because of a need that our founders realized when they were going through a personal experience with cancer in their family, kind of realizing the need that everybody else must be feeling, and that they need access to these resources. So Cancer Services is happy to help. You can give us a call at our main line, which is 505-259-9583. And we are happy to talk with you and help direct you to wherever we can. And of course, there's our LIPA program to get you the help that your family might need.
Thank you.
And I wanted to thank both Sonia and Angela for presenting today. And thank you for your time on a Sunday. So we
Thanks.
appreciate
You're
it.
welcome.
You have a good day.